I'm fascinated and I'm excited to talk to my guest today. She currently works as Director of Global Regulatory at Promo and Labeling Compliance for biotech. We aren't going to get into the names because we haven't gotten clearances. So she does not, just to be clear, she does not represent the company that she just started a job at. So this is just her opinion on talks today. And just to be clear, it is not intended to be legal advice, not intended to be compliance advice. It is purely for educational reasons, and it does not constitute an attorney-client relationship. I do actually want to talk a little bit. So if you are in medical affairs, if you are in regulatory, if you are in ad promo, you're going to care about today's discussion because you're going to understand a little bit about what happens in that black box everyone talks about, which is the PRC committee. What are we looking at? What are things that we consider? What is kind of hot right now? So I'm really excited for today's conversation. Our guest for today, Alice Lorenzo. How are you, Alice?
I'm fantastic. How are you doing?
I'm doing great. I'm excited because I get to talk to you. I get to talk to you when you are in a new job. Yes. So it comes with all new challenges and comes with a new exciting perspective where you get to discover and make things your own. Yes. So let's start with the first question. When you are starting a new job, and I don't know in this specific job, or you can speak in generalities, and I don't want to know which one you're doing right now, but do you find yourself having to make the policies your own? Or do you find yourself going, I need to fit into the culture of the company right now?
Wow, that's a great question. And it's actually both. So you do have to see what the culture of the company is, right? And kind of, we were talking a little bit like risk tolerance and where, what's in the policies and what are the requirements for their certain processes. But actually for this specific role I have now, one of the key things is building. So I'm basically building this program because my company is, fairly new in this area. So it's to me, it's a little bit of both. Previous experience, the policies were already in place, but do we revise them? Absolutely. Especially as like new leadership comes along and maybe there's different opinions about interpretations of different guidances and different opinions on risk too, and kind of what the company focuses. So
which is really exciting because you get to create a compliance team that you can stand behind because you made the policies, you understand what the rules are. So in general, do you tend to work with big pharma, emerging pharma, or something in the middle, or both?
Most recently, it's been biotech and emerging. Amazing technology. As you know, there's so much happening out there right now. And I've been working in the rare disease space, which I love. And that is a lot of just amazing technology and just incredible treatments to much needed patients. So, yeah.
So you talk about being in this emerging space. One of the things I've noticed in the emerging space is this idea that they're developing their own risk tolerance because that's early. That's something they're struggling with, or at least they're starting their thoughts around. What advice do you have for someone like you, but doesn't have your experience, who's in a emerging biotech, is in a emerging pharma, and or in rare disease, and they're going, I need to help create this department. I don't even know where to begin. Do I just copy? Do I get a consultant to create policies, or do I do it myself, or do I sort of do a hybrid and get a consultant to help me, but I need to oversee everything? How do you recommend they start?
The regulatory answer is it depends. That's always our answer. So, I think that it depends on how much you have on your plate starting this job, right? How much volume do you have? How quickly does it need to get up and running? So always it's helpful to use a consultant when needed. The only struggle I've seen in my past with, consultants is because they're not living, breathing inside the company day to day. It's hard for them to develop the policy. So if you're bringing in consultants, you really have to work together with them. As far as figuring out the tolerance, I think you get that from the culture. I think you kind of, you sense where the company is from a culture perspective. And then for me, I'm I'm not shy. So I'll ask questions and go to people in leadership, go to your management, go to different members of your team, we're talking about promotion. So go to your commercial side of the organization, your medical side of the organization. And I think just participating on PRC, and I know we're going to talk about MRC too, you get to know the risk tolerance of the various players. And for me, it's just been, it's always been, we can work through that together, unless something is a no-go. If something is an automatic no-go, like it's sort of not, that's not going to happen,
Which is interesting. What do you do in the situation in which, as the company is growing, as the company is emerging, they're still discovering their own risk tolerance. You almost see, especially in the emerging companies, factions of risk tolerance. Some are more risk tolerant, others are less risk tolerant. Do you then come in as the quote unquote voice of reason, or do you come in as what is the goal of the company? Like how do you assess and develop the risk tolerance, because that's going to guide the overall risk tolerance, because it doesn't matter what these factions say. In the end, you're the one signing off on it.
Well, a lot of times you can start a discussion and say, is that piece of promotional material really worth the risk value? Is that claim really worth? Like, let's talk about what that risk would be, right? Let's talk about an untitled letter. Let's talk about, maybe harm to the reputation of the company. Let's talk about things like that versus, is there another way we can do it? Can we go with something that is less risky? And also, most companies, the committees have an escalation process. So if I, as a reviewer, am really uncomfortable saying, look, I understand, colleague, what your goal is and I understand why you want to do this. I understand what you want to do. I'm not comfortable taking on that risk for the organization. So we're going to escalate it. And if you have a really well-run committee, where I gave the example of my experience with a really collaborative, then you don't have a lot of those. We do tend to work it out together. But sometimes if they have a certain goal and they've been given maybe a charge to kind of enter into a certain area, then that's when I would go to the escalation process if it's something that I just am not willing to speak to that risk for.
Which is very interesting, right? The escalation process by itself, I've worked with a few different companies with their different escalation processes, and each one is different. Let's leave it at that. Some of which are developing, some of which are very developed, and some of which are willy-nilly. And essentially, the escalation process lands up being, let me bring in a different set of eyes, as opposed to an escalation process. So do you recommend a formal escalation process for a small startup team who possibly doesn't have enough to require a formal escalation process? Or do you say it's all about having policies and procedures in place, and then how we handle them is a different situation?
I think it's the latter. It doesn't have to be a formalized escalation, even if you just want to say, okay, legal, medical, and regulatory is going to go back to their leadership, have this discussion, and they're going to talk to the marketing leadership or the commercial leadership and make a decision sort of offline. You can do it that way too. It doesn't have to be necessarily a formalized committee, but just getting that leadership buy-in to the risk, I think, is really important.
So that's interesting. You talk about leadership and you talk about commercial. Leadership is such a fuzzy word because it's one of those things we all throw around, let's be honest. But what does that really mean? Do we mean C-suite when we say leadership, or do we mean stakeholders, or do we mean my boss? What does that mean?
To me, it's who's in the level of authority to make the decision. It could be C-suite. It depends on if it's a very small company, it could be. Or it could be just people at a higher level in those various groups that have the autonomy and the authority to make those decisions. So they're likely right in touch with the CEO or right in touch with that, right? So they're taking on that responsibility, essentially.
So is that what the goal is? The goal is to give it to someone who can take on that responsibility and get the buy-ins that they need? Like, I guess I'm wondering, when you're constructing a PRC committee, is our goal to inform the C-suite of the risks, or is the goal, for example, is it operationalize, is it strategize, is it effectuate, or is it sort of get the right buy-in so that you can sort of do what the job you need to do? Does that question make sense?
Not sure.
I didn't phrase that very well, to be fair. So let me try that again.
Okay.
So if we're talking, is your goal in a role like the current role you have, is your goal to get up and get running? And if you try to do that, do you find yourself trying to those buy-ins that you need? Is that going to detract from you starting the process? That the consistent buy-ins from a bunch of different places, or is that consistent buy-in a critical portion of starting the process?
I wouldn't call it. I wouldn't necessarily say buy-in as much as I think it's just communication, and I think it's just making sure. I mean, and I've kind of done this. It's not even a really promotional compliance thing. It's sort of like throughout my career, right? I want to make sure. And I just had a conversation with my boss. Actually, I said, I always want you to know what might be coming your way, right? If it has to do with what I'm doing. So I think that you create your own process. So it is a lot of operational. I mean, I think the operational aspect is really important, and policies and procedures are really important for the consistency, especially if you're going to start to get high volume coming in with your materials. And so everybody's reviewing the same way. Everybody knows what their role is. They know how much time they have for their review. And then I think I think leadership just needs to be in the know when there's maybe higher level risk strategies under discussion.
And when you say leadership needs to be in the know, do you think about doing it in writing every time, or do you think about just verbal communications? Because obviously they have different ramifications.
I mean, if it happened, I've only been, it hasn't happened yet in my new job. If it did, I'd probably go to my direct supervisor, maybe our VP of regulatory, and have a conversation and say, okay, how do we want to do this? Do we want to have a meeting and just, talk about it? Do we want to put something in writing? I've had previous experience where it's been just like that, but then we do put something in writing as to why. So if the reason for the escalation is regulatory is not comfortable with giving an approval, then I make sure that I've clearly documented my rationale for my supervisor and for the other members of leadership that are going to be looking at, so they understand why I'm saying there's a risk.
Interesting. So you talk about risk, and that's a huge component of PRC review. And everyone's sort of doing a risk tolerance, risk assessment each time. And we spoke a little bit about what that actually means. So let's get into that a little bit. We talked about the difference between a PRC review, which is promotional review, and MRC review, which is medical. So in those cases, is the risk assessment different?
Well, that's a great question. I don't think so. I wouldn't say, I mean, you review differently, but I don't think your risk assessment is different. I think when it comes to medical materials, obviously the primary thing is to make sure that it's not promotional, right? To make sure that it kind of would meet snuff of scientific exchange, for the medical team to go out there and use that in the field. So that's been that's sort of the biggest risk when I think about medical on the MRC side. So it's a little bit different.
So let's talk about that. You use the word, it's not promotional. It's used for scientific exchange, which I agree with 100%. What I've seen struggles with is the definition of what is not promotional. It's easy to identify what is promotional. It's really hard to get into what is not promotional, because there's such little FDA guidance on what is scientific exchange, possibly because the FDA cannot give that guidance. And we can have a whole discussion on that. But the point being, when is something considered not promotional? And what I mean by that is, can you have a glossy visual with models or something like that for a scientific discussion, or is that considered to be promotional?
It depends. No. I wouldn't say glossy. You know, I've had reviews in the recent past where I've said things like, you know, guys, I don't think that those tone down the color, tone down things like that, because I think that the one guidance that came out, and you probably know better than I, it was back in 2000 something on scientific exchange that FDA put out there. Talked a lot about that, about colors and about how things look. So we do talk a lot about that. It's not to say that it can't be visually appealing or that the accurate, truthful medical information that's in the presentation can't be a little bit, you know, colorful or have certain things that, you know, the main point of this scientific discussion is going to be pulled out. Or made a little bit more visual for the person who's seeing it. But I definitely think, like, you wouldn't want to use the same colors as the promotional materials. You obviously don't want to use the logo and all those types of things. The other tricky part for me personally as a reviewer on both committees was that I felt some claims were crossing, right? Because you have some claims that they're scientific claims, but the commercial team is using them in their materials. And then you've got the medical team using them in their materials. So that was like a struggle for me, because I'm like, well, you're saying the same thing. Like, can't we say it a little differently? So yeah.
So let's explore that a little bit, because you're right. But I feel like that has been exacerbated by a lot of the PRC review tools out there. And I'm not going to name them because this is not about naming, and it's not even about shaming. It's just how it works out, which is you the way you set it up is you say, here's a claim and here's the reasoning I can make that claim. So which means that you have, by definition, you have a supportable claim there. If that's true, why would that not be considered to be scientific exchange? Because it is at that point a claim that's supported by science.
And that was actually a lot of the explanation when I would say something about that, and they weren't wrong. It's just I think it's more the context of how it's used. So if a promotional piece just is talking about mechanism of action or something like that, and they're using a claim there that, again, represents very similarly to an MRC piece that's talking about mechanism of action, that's where things, for me, the waters get muddied, right? So then we talk about risk again. So what's the risk of this? What's the risk of sending out my medical team with this deck that has this same, you know, claim in it on a mechanism of action slide or whatever material it is, the same as our commercial team out in the field? So there's no easy answer. It's a lot of discussion. It's a lot of negotiation. And if you have a collaborative team, which I was lucky enough to experience on both sides, you can work it out and you can strategize together.
Which is really a key component, a key piece of this. So let's talk a little bit about the teams that you pull together to review this. Do you find it better to have like the tiers of the teams? Is it about having different opinions, or is it about having different viewpoints, or is it about having different levels of support? And what I mean by that is, if you have a PRC team, for argument's sake, and that PRC team is your level 1, for lack of a better term, is your level 2 at that point just senior leadership, or is that a different set of eyes, or is that someone who possibly has a different opinion who can play devil's advocate? How do you make those decisions? How do you create that tiering system?
That's a great question. So if it depends on how large. If you have a larger, so an example in my past, I had more advertising and promotional colleagues to tap into. They were working on different TAs. So a lot of times we would collaborate together. And I was like, you guys ever seen this? You know, and they're making this claim. And we had products that had multiple indications. So several of us knew these products, maybe not that specific indication because we weren't working on it. So a lot of times I would go to them. Obviously my manager, supervisor who has experience in advertising and promotion, go to them. What do you think about this? Here's what I'm getting a gut check here. What do you think? So I don't know that I would necessarily say level 2 is leadership. I would say tap into colleagues. My medical colleagues, and my legal colleagues have been amazing, so helpful. And I would reach out to them. I mean, so many little Zoom conversations and so many little, hey, I'm reviewing this piece right now, and this is standing out to me. What do you think about this? So a lot of times it's kind of that offline collaboration too, and having those discussions and working it out. And the wonderful thing is, especially if I'm new to a product or a TA, like I remember most recently, my medical colleague would come back and be like, that's a good point. Why is that? Because my eyes are new to it all.
Right.
So like, well, why is that calling out to you right now? Like, what are you seeing? Like, I've been in this so long, maybe I'm not seeing it. And sometimes that would be the case. And sometimes it's just me getting up to speed on the science and the product.
Do you find yourself being questioned, saying, and I've been in these situations where you get labeled the problem person because you're questioning things that were done before. And sometimes it is because you're coming in with new eyes. Sometimes it's because something was missed. And sometimes it's just because you're trying to assess the company's risk tolerance. So how do you sort of start balancing all of those? Like, do you then, for example, one of the things I've been pulled into, for example, with a lot of these situations, I'll end up being the third party voice of reason. And I get asked, okay, what are you seeing? Because you're working with this across multiple companies. How are different companies assessing this level of risk? But how do you manage that and handle that from the inside perspective?
I like to say I don't know if people are thinking that about me. I just explain my position. So if it's, if I'm looking at something, and some of the, I think what you have to understand too is some of these pieces have existed for a long time. And maybe they've gone through cycle of review. And maybe it was like, well, we've been using it for this long and it just continues to get maybe reapproved. And then you have like a fresh set of eyes coming in as a new regulatory reviewer or new medical or new legal, looking at it saying, well, wait a minute, this isn't really up to standard, or hey, they missed this. I mean, I've seen pieces where I've seen the previous regulatory review did an amazing job. Like I could see their comments, but then maybe something that would be so quick to catch, like a brand and an established name or something, wasn't caught or was missed. And so I'd go back and be like, guys, that's kind of regulatory 101. And I'm sure it was just missed because there was all these other things to fix, and we're human and that happens sometimes. So I just explain it. I think if you are someone who comes to the table respecting everybody's opinion, and you show them you're trying to be, and you are collaborative, and it's not always a no. So it's a, we can't do it this way. Could we consider to do it this way?
Yes.
Right.
Yeah.
I think that's always a better approach. And I don't know. I don't know if anybody ever said that about me, but I hope not.
Well, it's one of those things that you always try to address so that you are proactively addressing the issues, and so that you never get labeled that. But it's one of those things, inevitably, as your role as legal, as regulatory, your job is to basically go, this won't work this way. We need to look at something else, and let's consider the other options. So it's something I found myself having to play that role, and people inevitably sort of come to a place where they go, okay, that makes sense. So how do we do this in a different way? And you usually find a path that makes sense for everyone. Go ahead, please.
I'm sorry. One thing I find interesting too is that sometimes I feel like maybe there's no, and it could be because of my compliance hat too, from healthcare compliance, thinking about where the rubber meets the road. So thinking about, okay, we're going to put this material in the hand of the reps, in the hand of the MSLs, and they're going to sit down and they're going to say this claim. And here's how you're training them, of their guardrails for this particular claim. And there's just a reality, right? There's just with any of us being human, some people are more comfortable in certain conversations than others. And so you just have to also, and sometimes I find that maybe that forethought hasn't gone into this too a little bit, you got to think about the rep out in the field who's a little bit more newer, right? A little more green. And what's their level of comfort being in front of that HCP and saying, you know what, I'm sorry, I can't have that conversation. Happy to turn you over to my medical colleague, Yeah.
Yeah. I love it. We can keep going, obviously. This is such a fun conversation. Thank you for taking the time. But before we go, a couple of things for people who want to ask more questions. Where can they reach you?
LinkedIn, I think, is the best way to reach out.
And that's on the screen for those people who need it, but it's linkedin.com/in/Alice Lorenzo. And Alice, any parting words?
Thank you so much. It's a great conversation. I really enjoyed it. Yeah.
Oh, you're very kind. Thank you so much. I appreciate you coming on. And this was such a great educational conversation. I hope you'll consider coming back.